All right, so let's talk about the SI joint and sacral float. This topic is near and dear to my heart because it has a big effect on your low back, hips, and your entire spine. And most people don't realize when it's dysfunctional how many problems it causes. And so I wanted to outline a few of the principles that we keep in mind when we are helping people with these problems. So first of all, with the anatomy, we're talking about the pelvic ring, which comprised of your left and right ilia and the sacrum. So we've got sort of a 3-bone complex here. There's a right SI joint, a left SI joint, the symphysis in the front, and then with this joint, there are anterior ligaments on the front side on both here, and then posterior ligaments on the back side. So both of those together, along with the symphysis joint, provide some of the structural support for the joint and allow movement. But there really only is a few degrees of movement at the SI joint. So there's a little bit of forward and back, there's a little bit of twist, and there's independent motions where one leg's going forward, other leg's going back. And so we think about the movement here as the sacrum is sort of the keystone in the middle of this joint, so it sits right in the middle and needs to be able to move around and float in all directions. And if it can't, then it causes problems. So one of the key things to realize with this is that the force from your legs comes up through your spine, through your sacrum, and vice versa. So force is coming down, travel through the sacrum, and so on. And so it's really important that this bone be able to float when you're moving and walking and exercising. It needs to be able to move in all directions, and when it doesn't, that's when problems happen. So we call this movement of the sacrum float. So it needs to be able to float in all these different directions with all the loads. And when you lose float in the joint, it basically forces the other joints to move differently, leading to injury. So if you have very tight SI joint on one side or both, and you're bending forward, it will cause overflexion or injury to your low back and or injury to your hips and so on. Regaining suppleness to your SI joint is foundational. You know, it really needs to be there, and if it's not there, we get all these negative effects. So regaining float is kind of the idea is that you're trying to get this biomechanical sweet spot back in play. And so if it can't float in all directions, then you lose function. And so because we need suppleness in all these ranges, we have to find a way to load the joint in a way that puts a very focal stress on the area that's tight and induces movement and suppleness back to the joint. And so with that, we have to make sure that our force that we use has a certain magnitude. It's got to be strong enough to induce change. It's got to have the right direction, and directionality is a big thing here because there's so many different ways the joint can move, and then the duration is important. So you have to sit on that ligament for 2 to 4 minutes to get a plastic change or the tissue to actually lengthen. If you just do a shorter stretch on it, it will rebound right back to the way it was. We really need to increase suppleness in the ligament. And keeping in mind, we talked about there's a front side and a back side, there's a left and a right, and there's all the various combinations of movement that we need to do. And so the best way that we have found to regain float in your SI joints is to use a medicine ball. So the medicine ball has the benefit of providing a distractive force or an opening type force. And if we think about this joint, we're on the right SI joint, we're in sort of the right plane here. We open it up like a book if we drop the leg out. So if I am laying on my back and opening up this way, I open up the front side of the joint. If instead, when I'm on the ball, I bring my leg this way, I can stretch the back side of the joint. So we can get both sides of the joint this way, as well as by moving our ball up and down a little bit with the leg in or out, altering your back position a little bit, gives you a way to get all those different forces that you need to regain suppleness in all those directions and get the float back. And then the last piece is just by sitting in the center over the ball, you can get some of the structures that actually cross midline and soften those up as well, so we get that left-right stretch as well and really get that last bit of float to come back. So that's what we're going to talk about next, is using the medicine ball to restore sacral float.